Adam, that's a big question, and it's a good question. Probably longer discussion than we can talk about right now. But basically, we have the starting issue that we had on healthcare is it costs too much. So the Republicans plan to do the revision and this disposition of Obamacare by a series of bills that the American people could read in time and understand in time, dealing with the issues, the affordability issues and the issues of accessibility of health care for everyone, and making sure we don't leave anybody without health care. We have laid forth some plans that have actually passed the House several times, one of which is allow us to go across state lines so that we can gather competition in to make sure that we get the coverage we want, the coverage that fits the individual, and that we have a market we can shop that coverage in. The free market always brings down prices. If you want an example of that, just in medicine, think of this. LASIK surgery on people's eyes and plastic surgery on fixing their faults, they are not covered by insurance by anybody. And here's what happens. That LASIK surgery, as an example, has gone from $5,000 an eye down to, in some places, $800 to $1,000 an eye in a short period of time, with better technology coming in every day, including a laser. All that says to you is when there's a market and there's competition, competition brings down the price. When you have somebody fixing prices, the government fixes prices, and unfortunately the government does a very poor job of fixing prices. So we just start there. Start with putting together the accessibility of plans to compete in the market so that you can get a plan that fits you and I can get a plan that fits me. My wife and I are over 65. We are moving into the higher risk category. Ours should cost more, and we should have desires that fit people over 65 in our plan. My wife doesn't need maternity benefits, and she clearly has had a hysterectomy and she doesn't need them. So we should be able to let the people that do purchase those, we should be able to structure a plan using the entire nation as our marketplace to come up with solutions. We should also allow associations, like I'll make up an example. All the barbers and hairdressers in the whole country should be able to form an association and get a group rate. We've passed that through Congress twice since I've been here. It has died mostly in the Senate. But that's the market judging how it works. I honestly believe if we take the market concept and let competition work, and we take each of the issues, including, by the way, most of these policies that we're talking about, what a great benefit is to let your kids stay on your policy till you're 26. When my kids were under 26, I had a policy that all my kids stayed on my policy while they were 26, until they were 26. It's not a new concept. It's just not everybody offers it. It may be what some people want. It may not be what other people want. That's the market. Let's let the market work.